Awesome. Well, thanks for joining me today. So first, just go ahead and introduce yourself to everybody.
Hey there, everybody. My name's Kristin, and I am a nurse, and I've been a nurse for many, many moons. I am not on the first line, so people say thank you, and I appreciate that, but I'm in administration more now. And what I do is I work for Johns Hopkins Home Care Group, and I'm one of the home care coordinators. So we are based out of Anne Arundel Medical Center. We contract with them, and we do all of their home care of people trying to get out of the hospital, especially now.
Well, I think you're very much part of the front lines. I mean, to say you're not, on the front lines just because maybe you're not in the hospital every day definitely doesn't mean you're not doing important work right now. So, thank you still for all of the work you're doing, and all of your colleagues. If it sounds like elephants, it's because my children are running wild upstairs. So sorry. Okay, so we are going to talk about proper mask wear and care and kind of dealing with some of the anxieties and kind of insecurities and fear factors that surround not only this time, but also kind of, masks being out and about and seeing masks being worn.
Yes.
So for starters, I know you have several different varieties of masks to show us.
Yes.
And I wanted to kind of get your insight from a professional standpoint about how we should be properly wearing our masks, but not only how we should be properly wearing them, but also properly caring for them. So when we take them off, how do we make sure we're taking them off correctly, wearing them correctly, and sanitizing them as well?
Okay, great. So I have 3 different types of masks. The first one that I'll show you is the N95 mask. This one is the mask that does fight against the coronavirus, the particles getting into your face. But if you're standing 6 feet away from people and you're not up in front of them, is this really needed? No, it's not really needed. If you can get a hold of an N95 mask, that's fantastic. But if not, it's still okay. You just need to stay 10 to 6 feet away from people. I try to stay 10. So that's the N95. So to care for your N95, if you have one, and nothing pretty about taking it on and off.
It's gorgeous.
But the best way to care for these is you take them and you put them into a paper bag. You can close it a little bit so it airs out. Okay. Now, they can last a week if you're not wearing them every day for 12 hours a day. The next mask is your simple surgical, they call them surgical masks, but these also have a metal piece in them, and some of the stores have them. If you go to a store and they have these, take one with you, put it on, and you can save this as well. You just want to take it and put it in a paper bag. Now, if someone's coughed on you or around you, they're not supposed to be that close to you anyway, right? But as I said, I'm not clinically right now in the clinical arena. I am on a phone at a desk assisting the case managers as well as the doctors for getting people home for home care. So we actually have this type of mask, or we also have one with a shield on it. So it's basically the same thing. However, this is nice because all it does is just goes around your ear and around your ear. And these are much easier to use, but it's great to pinch this and pull it way down. And I can breathe much better in this one. It's a lot easier. These, again, if you take care of them, they'll last. Normally, these are throwaway masks, but because the PPE, there's not a lot out there, it's something that you should keep. So this one, and I'll keep this for the rest of the week.
Okay. So for those of us who might have those surgical masks at home, we can just continue to reuse them as long as we just kind of let them, should we put them in a paper bag for how many hours, or should we Lysol them or anything, or
overnight?
Overnight.
You shouldn't be out that long that they're going to get full of moisture from you breathing. That you shouldn't be out that long. So now the cloth masks, this is my fave. Love my
beautiful Maryland Pride.
I know, right? So now, this is not it's important to wear these masks. It's important to wear a mask because it cuts down on people getting the COVID to you and you getting any type of, if you have a cold or something, to other people. Is this the ideal mask if you were working with people with COVID? No, but it's a great mask if you're not right up in front of them. When you are out and about. Basically, a lot of them do have the ears, the ear holders. This one has a tie, which I thought would be great to show you how to use this. Great. And then I'm going to nose in your mouth.
Okay, great.
You just take this and you want to tie it at your crown. Normally I'll have a ponytail up and I'll put it in between my hair and my ponytail so it stays up. And then again, this just goes like this and ties, and that's it. This should be washed after you've used it, just because it can be. Now, you will go around and you'll see people with this hanging down like this or this up like this because they whatever. This is not protecting anyone. But your nose has a mucosa in it, just like your mouth. It may not be as wet, but that is also goes into your respiratory system.
Right, right.
Covered. And it is good to have as well.
I'm sorry, you cut out. It is good to have what as well?
Eyewear.
Eyewear, gotcha. I mean, something as simple as, like, for those of us who don't really have anything else, would something like sunglasses be beneficial?
Yeah, it's better than nothing.
Okay, great.
Most important thing is to stay at least 6 feet, if not more, away from people.
Okay.
That's the most important thing.
So, we talked a little bit about the glasses fogging up with like the N95 or the surgical mask. They have those, the metal strip. And you said that to keep glasses from fogging up, if they're fit properly, if you have any sort of metal, you can really squeeze it against the bridge of the nose. So I have my cloth mask that I made. It does not have any sort of metal, but I did leave a pocket. So there's 2 questions I had about that. One, I could slide something like a pipe cleaner in there and help with the bridge of the nose, correct? Okay. Yes. The other question is, if we have these cloth masks, should we be putting any sort of filter, like a coffee filter or anything like that in them?
Should you, could you, you know, you can, but it may hurt. It may be harder to breathe through a coffee filter. Right. Get the N95 type filters from the big filters for people's homes and cut those, but you need to be careful because of respiratory. You want to be able to.
Right.
So look up on the internet, make sure you're putting the right thing in there.
Gotcha. Okay. All right. So anxiety and panic while wearing a mask. We definitely had a few questions about that. And I think some of it is true that when you're wearing something over top of your face, it feels more restrictive because it is more restrictive. But some people are saying when they have a mask on, it triggers an anxiety attack or a panic attack. So as someone who kind of wears these on the regular, or at least has more experience than most of us, do you have any advice for kind of breathing deeply and just kind of getting in the right mind frame when we're wearing a mask?
Yes. So the anxiety is real, the fear is real, and it can get stuffy, and it may trigger things for different people. You know, use your imagination, right? Something. A good way to help with this is just take some deep breaths, cleansing breaths in through your nose, and breathe, and then think about positive things and think that people are wearing to show love and compassion for other people as well as for themselves and their families. So not a negative thing. It's actually very positive when you see somebody wearing a mask. The thing about anxiety and panic and fear is it's real, and it's nobody's fault. It's an innate part of who we are. It's in our makeup. It's basically fight or flight, but it manifests different in us because we're not fighting or flighting like the cave people did. Because back then they get anxiety, well, what we call anxiety now, but that fight or flight because there's a tiger chasing them and their family.
Right.
Utilize that adrenaline and the steroids that are produced in your body, all the negative effects of stress and anxiety, they were able to do that, but you don't see us feeling that and running down the street like a chicken with our head cut off. We feel it internally, and then it just compounds. So remember that it's not your fault. It's real and it's genuine. However, you are in control of those feelings. And one thing I like to explain about anxiety, panic, and fear is that it is real. It's completely real. And it's part of our makeup. We can't stop that from being in who we are, but we can through counseling, through talking with friends about it, through, okay, I can do this. Maybe, you know what, today I'm not going to the store, but I'm going to put my mask on and I'm going to walk out to my car, and then I'm going to take it off, and I'm going to see that nothing's happening. It's not going to hurt me. There's nothing wrong with practicing wearing a mask at all. I highly recommend it.
Right. That's a great idea, to kind of practice in small increments, to kind of expose ourselves a bit more. Actually, you know what, even unthinkingly, I did that with my kids. We practiced putting them on and then running circles around the house and then coming back and taking them off. So what I'm hearing is that when we get those feelings of fear and panic and anxiety, recognize that what we're feeling is valid and real. And then also really focus on taking those big, deep breaths in through the nose, filling the entire body with the breath, and slow exhale rather than hyperventilating, which would definitely compound those feelings of fear and anxiety.
Right. Well, what happens is if you don't take deep breaths, you're not getting the air that you need to the bottom part of your lungs. So the end of your lungs have these cute little sacs on them. You can look it up. They're called alveoli, and they need to be expanded. But when we hyperventilate, what happens is we're not getting the air all the way down to them. And what happens is they collapse. And then we cannot get the air to the alveoli that then cross into the blood and jump onto our red blood cells. What happens is they collapse. So then we start feeling worse, and then we can't think because we're not getting air to where we need it. And
right. Then we get like that dizzy, like short of breath, kind of like feeling going to pass out feeling.
I'm sorry, it makes it worse physically. So that's another thing. If you have a chance to go look at, some things on YouTube or on the computer about, I'm so old, the computer. I'm surprised I didn't say if you do the Google and just put on the lungs, how they work, the alveoli, you'll understand more that those alveoli are the last thing that gets air. So you need to, the reason we deep breathe is and fill our lungs, cleansing breath, right? Well, that feels so good because you're getting more air to your system.
Right. Awesome. So really making those breaths count. And then I love what you said about the masks when you're out in public and you're seeing people wearing the masks. It's really a show of love and solidarity and kindness and compassion for yourself and other people. It's not something that we should be fearful of. We see people wearing masks. Oh my gosh, this is terrifying. Really, we see people wearing masks. This is a show of solidarity and a support. So it's kind of just flipping the script a little bit.
Yes. And as we said before, fear, anxiety is real. Panic is real. However, if we know where it comes from, perhaps we're able to control it a little bit more. And each time you have it, just take a step back, take the mask off, walk outside and take the mask off. It's okay. That is perfect. But the best thing that you can do is only go out for essentials. Coffee is kind of essential. No, actually, it's really not. But anyway, and make sure that you're standing 6 to 10 feet away from people. And if they're not doing it, you just back off. You just back off, back up. Do you really? I mean, I found myself, I was at Trader Joe's, which I like to say TJ's, the other day, and I really wanted to get lettuce. So I'm really used to just kind of, excuse me. And I had to oh, wait a minute. So I backed up, waited. I know it can even be more anxiety because you have to get home to your kids and everything. But if you just take a deep breath and think of this as people getting back to their humanity, because the majority of people out there are meeting their neighbors. You're going for walks. You're home with your kids. Yes, I almost tore my hair out today. My basement flooded right before this. And it's just one of those things that we just have to remember that we're all not in the same boat. As somebody said, I read an article, because people are dealing with it differently, but we all are fighting the same fight.
Right. No, that makes sense. So really just remembering that we're all kind of in this together. Our experiences might be a little bit different, but we can all get through it together, one step at a time.
Exactly.
So I know you also had gloves that you wanted to talk to us about, and the hand sanitizer. So should we be wearing gloves when we go out to the grocery store or to check the mail or anything like that?
You can. Checking the mail, I mean, you can, there's all sorts of things on the internet to do, but the best thing to do is always, clean your hands. If you don't have sanitizer, you use soap. But, it's really important to use the sanitizer the way you're supposed to. Get everywhere, just like when you wash your hands. And there's a really neat way to do this. If you go to Grawls, for instance, they do have gloves. And you can put the gloves on, and they have soap and water outside. So to show how much you're using the soap or water, you can put the gloves on. When you're done, put some hand sanitizer on the gloves, and then you can go and use some soap and water and see how you're washing your hands with your gloves on. Another thing to do is if you have peanut butter at home or something or mud, even if you want to make up some mud and you have an extra pair of gloves, I'm going to show you how to, don the gloves. You just take your glove and put it on like this, and then you take your other one. Of course, these are not sterile, so your hands are not sterile, remember, because they're gloves, they're not sterile. So and then I would use this in the grocery store, and then when I would leave, I would take them off. So before I do that, what you do is, if you have an extra pair of gloves, because it will help you learn, one, how to take off gloves the right way, and also how to wash your hands. So you put some peanut butter, and you just kind of wash your hands how you normally would, not a lot of peanut butter, and you'll see that there are areas that you missed. So when you wash your hands, it's the happy birthday song. And you really get in there, and because germs love the crevices. I keep my nails very short. I don't wear artificial nails right now. Because I want my nails to look pretty, but at the same time, right now is not pretty. I can't, because then it's getting germs in there, and I'm bringing it home to my family. So anyway, clean everything with the, but the peanut butter will help you see where you're missing. Now, you have peanut butter all over your hands, right? You don't want to get the peanut butter anywhere on your hands when you take the gloves off. So the way you do that is, and when we teach caregivers and people who literally, we had a class on how to do this. It was 45 minutes nursing school, and it wasn't easy at first. But we say, pretend it's poop, and you don't want poop on your hands, right?
I mean, that's valid, especially for those of us with kids. It's happened. That's valid.
Yeah. So what you do is you take your thumb, you pull it off, grab the glove, and then what you do, I don't know if you can see this, but I'm going to do it this way. And then that's a perfect little package, and then you just drop it in the trash.
Perfect. Drop it in the trash. Excellent. Awesome.
I hope that was helpful. This is the first time I've ever done this on a Zoom, so I'm a little, I don't know, it's just kind of different.
I know, it is different, but our whole life seems to have gone virtual. So, no, I think it was great. It was definitely informative. Proper mask wear is important. Make sure the nose is covered. Make sure the mouth is covered. Oh, and also kind of like when you took off the gloves, you didn't want to get stuff on you. Well, same thing with the masks. We should probably be taking them off instead of here, taking them off. Oops, got my glasses. Hold on. I'm stuck. Whew. Okay.
Guys, and clean your hands before you take off the mask.
Oh, okay, yeah. So sanitize your hands before taking off the mask. Remove the mask, put it in your paper bag, and then probably wash your hands again.
Yeah. Oh, yeah. Yes.
Exactly. So lots of hand washing.
Lots. Literally. So let me just tell you something interesting. So in home care, I ended up going into home care. I did critical care way back when. But in home care, you have your bag, you have your stethoscope, you have all your materials that are, wound care supplies and all that. So you go into a patient's home. Every time you go into that bag, you have got to sanitize your hands. Every time. Do you know how many times you go in and out of that bag? After you come out of the bag, you have to sanitize and wash your hands. It's actually amazing to me that there is so much hand sanitizer and soap gone. What were people doing before?
I know. Were you not washing? Were you not washing your hands? I'm gonna do the peanut butter trick with my kids just because I get so frustrated. I'll say, wash your hands, and they'll come right out of the bathroom, and I'll be like, I know you did not finish washing your hands yet, and I'll send them back in. So I'm gonna show them with the peanut butter trick that they need to wash their hands better.
Oh yeah, and brushing teeth too. That's a whole nother thing. But anybody has any great ideas to get your kids to brush their teeth the right way, please let me know. This was helpful, and I know I'm looking all over the place because I've never done this before. So
You're fine. You're fine. This was perfect. Thank you so much for all of the insight and the information.
Sure.
I love the takeaway that these masks are definitely a sign of solidarity and not a sign of chaos. And it's kind of just flipping the script there. So I appreciate it.
Yes, and also it's not political. A lot of people are trying to turn all this into political stuff. This is science, and it's our health and wellness. It has nothing to do with, we'll find out where it came from, but right now we really need to concentrate on being safe and healthy. That's the most important thing.
Right, exactly. Safety and health. Awesome. Well, I love it. Thank you so much. I really appreciate it.